Thank you very much for coming to our presentation. I'm Dr. Nathan Nickel, and we also have Dr. Julianne Sanguins. Today we're gathering virtually from all over the world. Many of us live and work on the traditional territories of Indigenous peoples dating back countless generations. Personally, I want to begin by acknowledging that I'm a guest here on the traditional homelands of the Métis Nation, and I pay my respects to the Métis and to their elders. I'm also a guest on Treaty 1, and I pay my respects to the Anishinaabe, the Cree, the Oji-Cree, the Dakota, and the Dene peoples, who are the stewards of this beautiful region. I want to honor the elders and knowledge keepers, grandmothers, both past and present. Many harms and atrocities were carried out on these lands, and the effects of them endure to this day. At Manitoba Center for Health Policy, we have deep respect for the treaties that were made on these lands, and we have dedicated ourselves to moving forward in meaningful partnership with Indigenous communities in the spirit of truth, reconciliation, and collaboration.
Good day. Any project like the one we're involved with involves a massive research team. And before you can see the names of everybody that's currently involved. It involves people from both the Manitoba Metis Federation and the Manitoba Center for Health Policy. The project is about prescription opioid use. The use of prescription opioids and the harms associated with them are rising in Canada, drastically so much, especially in the recent COVID epidemic. Several social and structural determinants increase risk of harms related to opioid use, including experiencing poverty, incarceration, and institutional and structural racism. The Manitoba Metis are one of the 3 Aboriginal groups that have been identified within the Canadian Constitution. They descend from Indigenous and European ancestry, and from that ancestry became a distinct nation. To be a citizen of the Manitoba Metis Federation, you have to be able to trace your roots back to the Red River settlement. You have to be identified within the contemporary context by a community as Métis, and you have to self-identify as Métis. They have had past and continue to experience ongoing colonization and racism.
Our project was interested in looking at trends in prescription opioid use amongst Métis citizens living in Manitoba. In order to do our research, we began using the data that are held in the Population Research Data Repository. On the screen here, we've just displayed the data sets that we use in our study, which included the census data, the Métis Registry of Métis citizens, vital statistics, information from our prescription drug program here in the province, which includes information on all prescription drugs dispensed within community pharmacies, the health insurance registry, which we use to identify individuals who are residents of the province, hospital discharge data, and data from the physician claims. We developed a cohort of individuals by identifying all those who lived in Manitoba at some point between the fiscal years 2006-7 and 2016-17. We ended up excluding individuals who were less than 10 years of age in our study. We next identified all Métis citizens and then all other Manitobans. On the bottom of the slide here, you see a breakdown of our cohort. Just over 68,000 individuals were identified as Métis in the 2006-7 fiscal year, and just under 1 million individuals were identified as non-Métis in that fiscal year. In 2016-17, we had close to 77,000 Métis citizens and just over 1.1 million non-Métis. We then calculated changes in the number of individuals receiving an opioid prescription during our study period, and we calculated annual opioid prescription rate by type. We tested for time trends for Métis and all other Manitobans, and tested for differences in those time trends. We stratified our analyses by age, sex, and by income. On this table here, we show the number of individuals who were receiving a prescription drug per 1,000 in our population. We've identified this by Métis on the left and all other Manitobans on the right. We have the numbers for 2006 and 2018 and as well the percent change. From this table here, we see that by and large, the number of individuals receiving prescription drugs has decreased between 2006 and 2018 for both Métis and all other Manitobans. The exception being hydromorphone, which has increased by 314.9% amongst Métis and increased by 251.4% amongst all other Manitobans. And tramadol, which increased for Métis by 386% and 340% for all other Manitobans. We then looked at trends for morphine equivalents over time. Morphine equivalence provides a type of intensity measure for opioid use. And we see the Métis on the top, all other Manitobans on the bottom. And this graph shows it by stratified by age. By and large, relatively constant, with a slight increase towards 2013 and then a decrease thereafter amongst Métis. A somewhat similar trend was observed for all other Manitobans. When we looked at the information by income quintile, we found that the time trends for all other Manitobans followed similar regardless of the income quintile. However, when we did tests amongst Métis, we found a significantly increasing trend for morphine equivalents amongst the highest income quintile, or Q5, which we see on the bottom of this graph here. So an increase in morphine equivalents amongst high income individuals who are Métis citizens. We looked at trends in morphine equivalents by different types, and we see relatively flat over time with a decrease in hydromorphone in the earlier years amongst Métis. We don't see a similar trend amongst all other Manitobans. But remember, we saw in the previous graph that there was an increase amongst high-income Métis citizens. And so we dug a little bit deeper to look at what was happening by trends in morphine equivalent by type for just the high-income earners. And what we see here is that amongst all other Manitobans on the bottom there, it was relatively flat. But we see for Métis high-income earners, increase in the yellow line, which corresponds with morphine. So an increase in morphine equivalents over time.
In conclusion, overall increases in the prescription of opioid dispensations increased in 2013 and then decreased in both groups. Examinations for why trends differ among Métis compared to all other Manitobans need to continue. And we just need to think about how institutional and structural racism impacts the medical care that Métis citizens have received and continue to receive. In closing, we'd like to acknowledge the commitment of the MMF President and Cabinet, our elders and our youth, the Public Health Agency of Canada for funding, and Métis citizens in Manitoba who allow us to serve them in our vision of a well Métis community. And it bears to mention again that the input of our team is very, very welcomed. Thank you for your attention.